The Minnesota Path to Value project is supported by a grant from the Minnesota Department of Health, Office of Rural Health and Primary Care. The purpose of the project is to provide multi-year technical assistance to selected Minnesota critical access hospitals and their communities to improve population health by sustaining an integrated clinical and community-based care delivery model. Technical assistance included education, webinars, peer-sharing calls, and group workshops, all combined with individual on-site community planning events to develop customized solutions to improve the health and well-being of the community.
Our community is really made up of small communities like Staples and Motley, comprised mostly of rural residents that live in our outskirt rural communities. Lakewood Health System is a 25-bed critical access hospital. We have 5 rural health clinics that are part of our system, long-term care, 2 assisted living facilities. We really are a cradle-to-grave system that provides comprehensive services throughout a lifetime.
We pride ourselves on relationships with the patients. We have a very strong medical staff here, and I think our administration and medical staff work very well together.
What I've learned through the years working here at Lakewood is that the community members really have a reliance on Lakewood Health System when it comes to their healthcare and their medical needs.
The intended population for this project was congestive heart failure patients.
Our initial data and where we felt that we wanted to impact CHF patients or congestive heart failure patients came from some of our data from our ACO groupings, and really trying to move the mark on those kind of higher cost and high risk patients.
It was really something that we could get the providers behind because they feel like it's one of the most impactful programs. I mean, I think you can improve quality of life.
The goal was really to catch earlier intervention for them before they end up in the hospital or emergency department. Try and do med management earlier, get more care arms around these patients so they get to stay in their house and healthy as long as possible.
We've paired with Health Recovery Solutions, or HRS company, to help us provide remote monitoring devices.
When a patient is enrolled in our program, we send them out a box that comes with everything that they need. They open the box, it comes with a tablet that has its own service. They don't need Wi-Fi or internet. It comes with a blood pressure cuff, an oximeter, and a scale. All they have to do is be able to charge their unit. It gets sent to us electronically, and then we use that information, we enter the data into their chart, and then we can change their care if needed, or just monitor them if they're stable.
So within this project, our framework of SDOH screenings has been vital to identify those with congestive heart failure that may be experiencing barriers to care outside of our clinic walls.
With all of our population here at Lakewood, food insecurity is a big one.
Not only do we screen and refer, but we have available assistance directly in clinic at every point of care.
The food pharmacy program is a nutrition-based program and within Lakewood Health System, so all of our patients are referred to us from the clinic setting, and we have about 130 patients on that panel. And so during the winter months, they receive a food share, and that consists of lean meats and some fresh produce as well. And then during the summer months, they receive farmers market bucks, and those market bucks can be used for any whole food type items, so meat, produce, dairy, eggs, those kinds of things out at the farmers market. And they get those every week, and then they get to go and shop the market on what they see fit.
We have frozen meals up on our hospital floor, so upon discharge, if there's a worry about the ability to afford, cook, or purchase food, a patient will go home with frozen meals during their recovery time. We want to make sure that mom's being fed so that we can take care of little.
When a patient is a part of our medical home group or has a home monitoring device, they're also supplied with a care plan, which basically is you have a goal of maintaining or making stability of your CHF diagnosis and then the interventions that are in place also.
We were kind of developing a bit of a population health program, but the work was really being done in silos. And I looked at, when I looked at the overall concept of Minnesota Path to Value, it really looked at, how do we coordinate efforts. So how do we bring social services, how do we bring clinic nursing, how do we bring providers, how do we bring pop health all to the table to work on a common goal?
So the work we're doing right now is really the foundation of how we start addressing these social risk factors inside our walls, as well as leveraging community partnerships to create thriving communities for us all. The tools of this project are not only helping us wrap our arms better around congestive heart failure, but it's really a framework that can be applied across various panels and patient populations.
Care coordination and the remote care monitoring has improved the patient experience by giving them that independence, but also that drive. It gives them, that ability to utilize this technology that they may or may not have had done in the past.
On a micro level, definitely have seen a reduction in readmissions and improvement in quality of life scores. So
all of these efforts, those non-traditional pathways to advancing how we can care for the families we serve, it provides a trust building opportunity with patients and our care teams that goes beyond traditional medicine. And it goes to the root of some of the challenges our families are experiencing that we may have historically not talked about.
I'm really proud of our team. We've done just amazing work, and we have some really dedicated individuals who have continued to show up and roll with some of these punches and the adversity that we've had to overcome, but continue to just really keep the patients in the forefront of our goals and how can we work through this, how can we better serve our patients.